Chief guest of the evening, my longtime friend, Dr. Rajendra Badwe, Sri VP Joy, he is probably known as a Chief Secretary, but I admire him for the poetic excellence. He can be easily passed up along with ONB or Kumari from the beauty of his lyrics, and he probably would have read that in periodicals and books. My mentor, role model, and the greatest teacher I have ever seen in my life, both in India and abroad, Professor K.V. Krishnadas. And Dr. K.P. Paulos, whose articles in New England Journal of Medicine was the inspiration for many of us to migrate to USA. And Chandramohan, who has the enormous potentials to become an international leader in surgical oncology. And Bobbin Thomas, perhaps the finest medical oncologist in Kerala right now. And my dear friends, it's a great honor for me to give the presidential address to such an august audience of intellectuals, professionals, and academicians. I'm delighted because today's award-winning Dr. Rajendra Badwe was the close friend of my uncle at Tata Memorial Hospital long time ago. You know, Tata Memorial Hospital is financed partly by the atomic energy. So the CEO is appointed by atomic energy. My uncle, Mr. S.G. NAIR, was the CEO, and Raj's father, Mr. Achyut Badwe, was the administrator. So I had several visits to Tata Memorial Hospital to spend time with Dr. Praful Desai and Raj's father and my uncle. And I was almost like an honorary student/faculty of Tata Memorial Hospital from the days of Dr. Advani, Dr. Desai and all. I'm so glad that he has established himself as an international leader with the commendable presentation at the European Society of Medical Oncology on the role of local infiltration with 0.5% lidocaine in reducing the relapse and mortality of early breast cancer. Now, this is something unique. So far, we have been blind followers of the Western medicine, and whatever the United States or the UK dictate to us, we were meekly following them. The first time, here's a study which is likely to change the landscape of breast cancer management. I was so happy to read the full script of this study, published at ESMO, presented at ESMO by Raj, and later published in Annals of Surgical, I think Annals of Surgery. Here are the key points. 1,600 breast cancer patients pooled from 11 centers in India were prospectively studied for 11 years. And you're going to hear more about that from him. Within these 11 years, those cases where the surgeons applied 0.5% lidocaine around the biopsy site had a lesser number of relapse and a lesser number of mortality rates. He's going to give you the actual data. Amazing. It's a prospective study, 1,600 patients from different cancer institutes, and I was happy to hear that 30 of them were from Kerala. Kerala is now considered to be the state with the highest incidence of breast cancer. We could have put more, but at least we have 30 patients. What is causing this? How can a local anesthetic change the biology of breast cancer? Interesting. The hypothesis was that the voltage velocity of sodium pumps in the cells, which can promote metastasis, can be neutralized by the lidocaine. Just a hypothesis. Nobody has proven that yet. But whatever it is, today, with 100 rupees and a small syringe of 0.5% lidocaine, if you do the biopsy, those patients have lesser chance of relapse and a lesser chance of death from breast cancer. It's mind-boggling, but I'm glad that it was presented to a world audience. More studies are going to come up. I say more studies are going to come up because the Lynn Symposium on Breast Cancer in Chicago about 4 weeks ago touched upon this topic. They were hypothesizing that tumor infiltrating lymphocytes, the TIL, we all know that if a tumor is infiltrated with lymphocytes, they carry a better prognosis. This has been seen in lung cancer, in colon cancer, in triple negative breast cancer. Are we dealing with initiating tumor infiltration by lymphocytes? We don't know. If that's the case, by any stretch of imagination, if 0.5% lidocaine can do that, how about 1%? Can we invite more lymphocytes to the tumor site and improve the outcome of this trial? Fascinating concepts. But I'm sure Raj has a checklist of things which he's going to go through, and the study is still in full swing. Congratulations, Dr. Raj Badwe. We are proud of you, and I want you to take the leadership of Cancer Care India. That's the second point I want to harp on. The American medicine, when remodeled, had 3 mottos: accessibility, affordability, and quality. The 3 catchwords of Obamacare. You know, in many socialist countries, including UK and Canada, a breast cancer patient may have to wait up to 3-4 months to get a biopsy or a surgical consultation. This is not acceptable to WHO. Now, I belong to the consultation committee of Global Breast Cancer Initiative of WHO. There are definite guidelines. The time from a clinical suspicion to a biopsy should not exceed 60 days. The time from a biopsy to the beginning of multidisciplinary treatment should not take more than 60 days. The multidisciplinary treatment and the follow-up should ensure that 80% of these cases are alive and healthy at the end of 5 years. This is the guideline WHO is recommending. Brazil, like in soccer or football, is doing the best. They have become the role models. Tanzania, of all the places, is joining them. India is lagging behind. The best study came from the Sanjeev Gandhi Institute in UP, and I am waiting for the study from Tata Memorial Hospital. But Tata Memorial taught us something equally valuable. Where does we stand in breast self-examination or clinical breast examination? Because we can't afford to do mammogram for half the population of India. The breast self-examination is not used as a recommended guideline in many of the developed countries. Keep in mind, we are talking about the mortality impact. But clinical breast examination, many people, including Chinese, were bragging that can bring down the mortality. There was an excellent study from Tata Memorial Hospital, Indraneel and his group, which showed that among the 4,000 people who underwent clinical breast examination, only 4 had biopsy-proven breast cancer. So that's also an iffy now. So we still need to go further in finding out a better way of screening your breast cancer patients. Kerala is in particularly concerned because India's breast cancer incidence is the highest in Kerala. Maybe the lifestyle, maybe something else we still don't know. So we need the help and guidance from national, international leaders like Dr. Raj Badwe. Third one is a practical thing. I know some of the journalists are here. The last 2 months I have been called upon to see and reassure 8 VIPs in India and Kerala. I was really startled to find that the treatment is being messed up by a parallel stream of spiritual leaders. Please keep in mind, spiritual leaders. I don't want to name anybody. These are all highly accomplished professionals, highly placed administrators, but the treatment is being messed by spiritual leaders and astrologers. Why is this happening in India? Why is this happening in Kerala, considered to be the most literate, educated, and well-informed state? We don't know. I think the common denominator I could find in many cases is a total break of communication between the patient, family, and the treating doctor. The doctors have an excuse, legitimately so, because they are seeing so many patients, and they cannot spend more than 15 or 20 minutes with the patient. That's true, I agree. Okay, I worked here. but we need to find a solution for this. What happens is after this 20 minutes interview with an oncologist, many of these patients are totally miserable. And somebody plants this idea of a spiritual leader or an astrologer or a homeopath or a Siddha Vaidyan or an Ayurvedic physician somewhere. And from then onwards, although they come for treatment, their treatment is taken over partly by factor X. This is a real problem. I didn't realize the enormous dimension of this issue until I came to Kerala this time. Like I said, about 7 of them, I'm just helping them to understand the nature of their disease. All 7 are under the care of spiritual leaders. The spiritual leaders tell them not to take chemotherapy on certain days, certain weeks. Defer it or deny it. Delay surgery as much as you can because your stars are not working for you. And believe me, many success in our cancer treatment, especially using chemotherapy, came from dose dependency and schedule dependency. If you don't stick to the schedule, if you don't stick to the dose, it's a total waste of your effort. And last but not the least, there are spurious drugs all over the country now. In today's Times of India, you probably would have seen some of the reputed pharmaceutical firms have been charge-sheeted for manufacturing thalidomide or levodomide, lenalidomide, drug we use for myeloma and myelodysplastic syndrome, totally spurious. So how are we going to overcome all these things? Last week, when I was in New Delhi, one of my longtime friends, Mr. C.V. Ananda Bose, he took me for dinner because we know each other for 50 years. About 3 days later, he became the West Bengal governor. I think he is very close to the Prime Minister. He shared an idea with me. The Prime Minister, as part of the Atma Nirbhar Bharat, wants to have a medical city like Houston or Boston. Those of you who have been to USA know that Houston was once considered to be the Mecca of medicine. You have the cardiac surgery unit there, the M.D. Anderson Cancer Center there, so it is a Mecca of medicine. Prime Minister is now suggesting, can we have a city like that in the center of India, where any treatment available anywhere in the world is provided to the people of India. It's a beautiful concept, and I'm sure they will be opening it up for Raj and G.K. Rath and the new National Cancer Institute director coming up in Haryana, and planners, thinkers, shakers and movers of India. But that's an idea which is evolving. And last but not the least, a good psycho-oncology setup is the must of the hour. All these patients are fizzling out, are going somewhere out because their psychological needs are not met. They are depressed, they are anxious, they have phobias, and the only people who know how to handle that are the spiritual leaders. So it's time that our major cancer institutes start a vigorous training program for psycho-oncologists, just like what TMH has done for navigators, patient navigators. I understand they have a master's program in patient navigation. I think the consumer of tomorrow requires it and demands it. And I don't have to elaborate that part today when in northern Kerala, a doctor is being prosecuted for amputating a leg. And in southern Kerala, a brilliant upcoming neurosurgeon is in the hospital threatening to quit her profession because a patient mercilessly attacked her. That's the situation. I think it is no longer a scientific theme, it's a social theme. We all have to put together our head together. So, ladies and gentlemen, with all the pride of complimenting Dr. Raj Badwe, I suggest that he, Dr. Rath, and other senior leaders of the profession in India start thinking about an NCCI, a National Coalition of Cancer Centers of India. NCCI would be focusing on mostly accessibility, affordability, and quality of cancer care. We made a small beginning in 2000, and I was instrumental in introducing that in Jaipur. Dr. Desai was there. Our former President APJ Abdul Kalam inaugurated that, and it metamorphosed into the National Cancer Grid, which I understand CS Pramesh is heading. Good, that much is great. But we have miles to go before we sleep. With that, I conclude my words. Thank you for your attention. Thank you for giving me the opportunity to address such a distinguished gathering of oncology professionals and well-wishers. Thank you.